All right, we're back with Dr. Kohli from 9 News from Cherry Creek Heart, which is her practice. And we are talking today about your heart age. Yes, it's not just like, oh, here's how old I am. Here's how my heart is. So why don't we talk with, like, what is heart age and how do you calculate it?
So, Jenny, as a cardiologist, one of the things that I struggle with most is trying to help people understand their risk. So if I said to you, your risk of having a heart attack over the next 10 years is 7.2%. That doesn't really sort of resonate, right?
Yeah.
You don't really understand what that means as a risk. So we've really been trying to shift towards looking at something called your tissue age versus your chronological age. So your chronological age is how many years since you were born, right? That's the number of years you celebrate that on your birthday. Now we're looking at, well, how are your organs aging compared to how your chronological age is? And
So
of
you
course,
could be 35 and your organs are 80. Yeah.
Exactly right. So, and this doesn't just apply to heart age. It applies to your blood vessel age. It applies to your brain age. It applies to all your organs. So it's a new way of sort of thinking about capturing risk. And we were really surprised to learn that the average American's heart age is significantly older than their chronological age.
Yeah. And so why is it so important to know that exact heart age for us, for you? Yeah.
Yeah. So I want you to go home and calculate it and report back to me.
Okay.
And it's really, really important because it's a kick in the butt. It's a wake-up call, right? It tells you, oh my gosh, what you really want is your heart age to be lower than your chronological age. I was happy to calculate mine. It came out 4 years lower.
There you go.
Yes.
See?
Yes, I was feeling really thrilled about that. But I can still do better. You can always do better. But if your chronological age is substantially less than your heart age, meaning your organs are actually aging faster, that means there's something you can do. Because if you think about the factors that go into that heart age calculator, the only thing that's not modifiable is your chronological age, your family history, and your gender, right? Those are things you can't change. Everything else, blood pressure, cholesterol, blood sugar, weight, smoking status, these are all modifiable. So to me, it's a really nice way to say, okay, I'm missing the boat. The average American here is missing the boat. That's what this report is telling us, that they need to do better so they can actually institute changes so that they can slow down their heart aging and actually potentially even reverse that trend. So this is kind of a cry for an intervention.
Okay.
It's to calculate your age so that you can say, am I doing okay or do I need to do better?
Or am I like in dog years? Like, is a carry a 2 out of 7? Like, what is it? Hopefully not. But I know that's something that heart is huge in my family. My dad, my grandfather, we've had heart issues.
Well, it's the most common thing. It's going to happen to any of us, right? Heart disease, #1 killer, men and women, U.S. and worldwide.
And it took me a long time to start figuring out how important it was with, and then losing all the weight and everything like that. It's definitely, my heart age is a little bit less, which is good, but I'm kind of scared to calculate it. But we were
No,
okay.
Don't be scared. Be empowered. That's how I want you to think about it, right?
Yep.
Yeah.
And who was in this study? Who do you think has the worst heart age typically?
Yep. So they compared, obviously, the average American man and woman. So men do worse than women.
Okay.
So men's, heart age is usually older than women's. Black men do the worst.
Okay.
Black women also do the worst.
Okay.
And then you have the Hispanics. And then interestingly, if you look at patients or people who haven't had a high school education, their heart age is actually 10 years older than their chronological age for many of them. So what we really realize is that there's so many factors, including health literacy and literacy in general, that go into basically how our heart ages. For the Black and Hispanics, we think it's probably access to care, as well as some socioeconomic differences, perhaps even some biological differences, because we know that Black patients can have high blood pressure that comes on earlier. We know that certain ethnicities like South Asian, like myself, or Hispanic can be higher risk for heart disease because of their genetic background. So what it helps us to do is really put target signs on people to really try to understand who's aging faster. And if you're a person of color, you're aging the fastest. But all Americans, even the white Americans, are aging faster than they should according to their chronological age.
So what can we do? How do we keep our heart age low? How do we be able to function better as a society doing that?
So simple things you can do. I want you to go to the American Heart Association website, and they have a score called the Life's Essential 8. And you do these 8 things, you will reduce your risk of having a heart attack and stroke substantially. Some estimates even say up to 80%.
Wow.
And you can, like I said, even reverse some of these changes so that your heart age starts to slow down and your chronological age sort of starts to catch up. So I want 2 homework assignments. One is calculate your heart age.
Okay.
And then the second is to go to the American Heart Association website, life's essential 8. And these are lifestyle things that we've talked about. Sleeping the 7 to 9 hours a night, eating well-balanced meal. Every plate should have half fruits or vegetables, a quarter lean protein, like chicken or fish or tofu, and then a quarter should be a whole grain. And you want to make sure to keep your stress in check. You want to make sure that weight is maintained, the blood pressure, the blood sugar, the blood cholesterol. Don't smoke, don't drink too much alcohol. Basic things that we've talked about before that are very well within our control to control our heart age.
And I think that's the hard thing, is that we can control it.
Yes.
And just kind of a quick reminder to double check. And I mean, it's never too late to start doing it too, but it's way better to start early. That's all I would have to say. It's a lot easier to do it in your 20s than it is when you start getting 30s.
Well, and today we just talked about heart age, but all these things also protect your brain age. And one of the things I worry about the most as I age, I worry about stroke, I worry about dementia, right? We all do. And so if you do these things now, you're actually going to reduce your risk of vascular dementia and stroke as well.
All right. So check your heart age. I know I don't ever want to grow up anyway, but I definitely don't want my heart growing any older. So thank you, Dr. Kohli from Cherry Creek Heart, 9 News. Make sure you check her out and check your heart.